Hey, I want to say good morning to everybody. Ariana, you want to turn your camera on for just a minute and show our smiling little faces?
Let me figure this out.
You should just be able to click on the little icon down below. It should say stop video or start video. It should be at the bottom near the left.
Oh, I see it, yes.
There you go. There you go. So good morning, everybody. I'm Mike Poling with Lightwave and ABI Skincare. And then we have Ariana here. Ariana, want to say hi?
How are you guys doing?
Well, they're muted, so they can't respond.
Oh, they're muted. Okay.
I have them all muted. I was just trying to save it from a little of the chatter. So, so we appreciate you guys joining, ladies joining us today. We're going to be going over some training. This is a kind of an initial Lightwave owners training. We wanted to hit a few key points for you today because we've had a lot of people purchase. We haven't had a lot of training options with lack of conferences and in-person training and such. So we figured we'd get a little bit on top of the online training option and get you taken care of. So some of the areas we're going to cover today, we're going to do a Lightwave device overview, talk a little bit about functionality, the buttons, the modes, and such like that, just to make sure you understand how to operate it. Most of you are probably using it for a while, so it's probably not anything too challenging. But we definitely want to go over that. Talk about the difference between Lightwave and Topical Light Infusion. It's very important to understand the two different modes that are available, all the treatment options that are included and potential for you to use. Talk about protocols, suggested pricing, packages, and let's talk about how do you make some money and really present this to your clients, because I think that's one of the big elements that we've received as far as needing some more assistance on. Yeah, I've got this great piece of equipment, I know how to use it, but how do I really use it to the highest degree and capitalize the most on it? So we're going to go through that today. We're expecting around 45 minutes, maybe to an hour, so this shouldn't be too extensive. Question wise, if you have questions, just write them down or put them in the chat window. As we get to a point where we take a little bit of break, we'll take a couple minutes to maybe address those questions. If not, we'll do it at the end, or maybe even one off. If it's a more complicated question, maybe we'll do it after the training. I just don't want to delay it too long. But questions are okay. Like I said, in the chat window, you should have that up there as well. If not, just write them down and we'll get to them later. So anyways, I'm going to go ahead and go over a couple things real quick. And I'm going to bounce over to Ariana. So basically, I want to start with talking about the system. Everybody here has bought the Lightwave system, and you are all owners of that particular device or one of our devices. So I want to talk about a few key things that are important to understand as far as operating the system. Assuming everybody's got it out of the box, packaged up, at least fired up or to that point. One of the things is when the system does ship out, it is limited usage on the Lightwave mode. So what that means is there's only so many Lightwave treatments you can do before it'll go into a lock status. You simply just have to call us, spend a minute on the phone, you give us a code, we give you a code back. That will permanently unlock it. And we do that to prevent theft. Unfortunately, we've had a few units stolen in transit. This prevents somebody from getting a free system and just using it as much as you want. So you have 200 to start. Usually it's enough for a month or two, maybe even 3 months, depending how much you're using it. But you can call us at any time the day you get it, or when you're down to your last treatment. But try not to do it on a Friday night at 6 o'clock because we don't have staff here. So we highly recommend doing it Monday through Friday. 8 to 5 is our standard hours. Give us a call. It takes literally just a couple minutes. So you should have also received with your system a bunch of paperwork, a bunch of manuals, and some of the stuff we're going to cover today. So you might have seen some books like this. You've got an operator's manual. You've got a protocol booklet for Lightwave, a protocol booklet for Topical Infusion. You got information on the ABI skincare, as well as a few other training documents. So those should all have been included. We have soft copies of these as well. So if you need additional copies, we can send you the PDF. You can print them off or just save them. They're also available on our website and our resource center at lightwavetherapy.com, as well as ABIskincare.com. There's a lot of information on the Topical Light Infusion and the ABI skincare. So these books are great, good protocols, good information to get you started. So I'm gonna switch cameras right here, and we're gonna go over a few things as far as the system goes. Let me do this real quick. I apologize, this camera's a little blurry. I don't know why. I was trying to mess around with it before we started, but we're gonna give it a whirl. So there we go. All right. So main unit wise, you should have received, your system. You should have a main unit. And so if you ever call in, you need tech support or any training, please call us, and we're here to help. This is your main unit. It has the touch screen, the brains, the power of the system. So that's the thing we call it. If you have a problem with that, say main unit will know what you're talking about. And then we have an LED panel. So all of our systems have some type of LED panel. This is our React 1200, but you may have the Pro or the Elite. Again, we refer to them all the same. So that should be plugged into your system. There's a little red dot and a little mark on there that it's keyed. So if you plug it in properly, it will actually register on the unit. So one of the things we get a lot of questions on is how do we, navigate, and what's the difference between topical light infusion and lightwave mode on the actual equipment? Because there's a little confusion sometimes in there. We want to, go over that real quick so you just understand, the difference between the two. And I'm going to make my screen bigger so I can actually see this and make sure you can actually see it yourself. So let's go here. There we go. So it's a little blurry, and I apologize for that. We're trying to fix the video on it. For some reason, it's just been a little bit blurry. 1 second, let me allow these people in. All right, we got a lot of people joining. Hello, everybody, just joining. We're already started. Just kind of sit back and enjoy, and we'll go over some stuff here. So this is the main unit screen. When you first boot up, it's going to go into lightwave mode. I'm going to go to the top screen. Lightwave mode, and then there's topical light infusion mode. But by default, it's going to go into LED, lightwave mode, lightwave 1, anti-aging. You kind of see that on the screen right here. Again, it's a little blurry. If you're having some problems with the unit and it doesn't display this when you first boot it up, either this socket is not plugged in properly or there's something wrong with the panel. And just give us a call and we'll figure out what we need to do. This little button right here should light up and it should say the name of the device. I know it's a little blurry, but it should say the name of the device in this little socket 1, this little icon that's up here in the upper left-hand corner. So if you don't see that, there's something going on, call us up, we'll fix that. In here, it's going to tell you the mode you're in, the treatment you're on, and the total run time. So on the screen, it's very easy to understand what you're going to be doing. Down here, it's going to tell you how much of each wavelength it's running: red light, infrared light, red or blue light. Again, it's blurry, sorry, but it'll tell you exactly how long each wavelength of light's going to run and how many times it's going to do the cycle. So you have all your information here. As far as navigation, very simple. You have next and previous. So if you want to go to the next program, you simply hit the next button right here. It's going to go to Lightwave 2, pigmentation. Again, the time change from 27 minutes to 24 for this particular one. Scars, 25 minutes, preventive care, flaccid skin, and so on. So you can actually see the change in time and down here. As most of you probably already know, you just hit the green start button and it's going to run the particular setting that you have in here for the particular time. Now, one of the things we see, especially people who first get their system, is they don't realize they're in lightwave mode versus topical light infusion mode. So this button right here is your topical light infusion mode. And what that does is essentially changes what's going on in the screen here to the topical infusion mode. So if I press this button, you'll see it'll actually prompt you and it says you're now using topical light infusion mode. Hit OK. And now get a little bit better angle there. Now you can see that it says TLI, wrinkle repair, treatment, total runtime 21 minutes. So now we're utilizing the topical infusion mode and it's not LED mode. And that's really important just because those are limited usage. It ties into actually how much topicals you have, or you don't want to waste those. If for some reason you happen to use it by accident and waste a couple of those or use them by accident, give us a call. We can load a couple of those in. But to switch back to lightwave mode, you simply touch this LW mode button down here at the bottom. Now it'll say you're now using lightwave mode and you're in the lightwave mode. So switching, toggling back and forth is very simple, very easy. Just pay attention to where you're at. One thing to talk about when you're in the topical light infusion mode is you have the ability to add the lightwave treatment to it. So when you're doing topical light infusion, you can do that as a standalone, and we'll talk a little bit more about that in protocols. Or you can use lightwave in standalone mode, or you can combine the two. And this button right down here that says LW off, try to see if you can see that. Right now it's toggled in the off position. What that means, we're just going to do infusion only. If I turn this on, it'll actually add and say with LED, and it makes it a little bit longer, and it's added a lightwave step. So you'll see in a lot of protocols, if you read through the manuals, that it talks about doing a combination topical infusion with lightwave. And that's how we've made it simple for you to do by having a simple button that will turn that option on or off by just simply pressing that. So again, if I want to turn that off, you'll see that it changes. It's still doing the wrinkle repair, but it's just infusion, and it says just the infusion step versus wrinkle repair with LED Lightwave, for 12 minutes on this particular one, and then infusion for the 21 minutes. So anyways, that's real important. That's probably one of the things that takes a second to get used to, just understanding a couple of the buttons. Really nothing too complicated there. If you have any questions, let us know. Button down here in the bottom right hand corner, there's a power button, and then there's also the button next to it, which is a gear and icon. That is your config screen. And there, that allows you to see some of the configurations. And really the thing you'll use is over here is these add treatments, add USB treatments, and then there's an update button over here as well. So that's what's going on in the config screen. And then as far as powering down, the proper way to power down is to hit the power button right here, hit the power button again at the login screen, and you can either shut down or restart at this point. I'm not going to do that because I don't want to reboot it. But that's the proper way to power it down. If you just flip the switch in the back, which is that little switch in the back here, if you just flip that, unfortunately, sometimes the software doesn't like that, and it can cause some problems. So do not flip that switch until you've actually gone through the shutdown process and selected one of these two, and the screen will turn off. And at that point, you can flip the switch in the back. The login, you should all know this by now, is 1111. So that gets you into the system. The fade button is not working. We're working on that's a new feature. We're going to allow the light to fade in and out, so it's not so intense. It doesn't have that shock effect. That's something that we've been working on for a little while. We have a huge update coming, hopefully here in the next couple of weeks, and we'll send out emails so you can download those updates and get that feature as well as some other improvements applied. Otherwise, we're going to talk about placement of the system and such like that here later. Let me switch my video camera. So we're going to talk about protocols and how to place the system and all that here in a little bit, so we can get through to that. So what we're going to dive into first is the Lightwave. I'm going to have Ariana take over. She has a good presentation. She and I, we're going to go through a lot of information. Again, questions, just let us know, and we'll take it from there. So Ariana, I'm going to delegate control, have you take over. I'm going to make you host.
Okay.
And there you go. So you should have control. You should be able to bring up your presentation.
Oh, yes. Give me one moment.
Perfect. Looks good.
Okay.
All right. You want to start, Ariana?
Sure. Okay, we're going to go over the Lightwave technology. We have a few slides that we'll go through, and we're going to keep it somewhat basic. We'll do another session going over more in depth of the science, but let's just keep it a little basic for today. We don't want to overwhelm you. So the goal of light therapy is to help strengthen and improve the appearance of overall skin health, and by repairing the cells. We're focusing on improving fine lines, skin tone texture, and overall clarity. Also reducing inflammation, acne lesions, relieving pain, and reducing edema and erythema. With Lightwave therapy, there's no irritation, no pain, no redness, no downtime, long-term results with simple maintenance plan, and ideal for men, women, and all skin types. The mechanism of Lightwave, it's very similar way that plants use chlorophyll to convert sunlight into plant tissue. The photon energy found in LEDs can trigger natural intracellular photobiochemical reactions known as photobiomodulation. So understanding light therapy, penetration and absorption of the energy, of the photon energy, are dependent upon many factors, including wavelength, the specific color of light being penetrated into the skin, the power output, treatment time, our dosage time, your machine's dosage times, your duration times, they are calculated off the power output of your machine. The design and delivery of the Lightwave therapy system, our LED panels do include chip on board technology, diodes. The LED, those type of LEDs are intense, a clean blanket of light, and they are, again, the dosage is focusing off or calculated off the output of your device. And then also another important factor is proper skin prep, because for the light therapy to work for anti-aging, the photon energy must be able to penetrate into the body and be absorbed by the target tissue and cells within the body. If the light there or the device wasn't high enough output, or the dosage time wasn't the correct dosage time, it's just going to take a longer time to see change over time.
Right. And let me add to that. So jump back to the last slide, if you don't mind, Ariana. So one of the nice things about having your Lightwave system, and you may have some savvy clients or patients that come in and they're going to ask you about wavelength and such like that. All that's in your owner's manual, the specific wavelength if you don't remember. But there's a lot of people out there who are doing research and they're trying to find the best device possible. They're not just going to spend their money on anything. So wavelength and power output is a big aspect. 630 red, 880 near infrared, and 420 blue. So that's important to understand. And our devices use clinical colors of light. We don't just throw any wavelength in there. So it's a nice thing you can sell them on as, hey, this is not off of Amazon or some cheap little gimmick that you can get off of Alibaba or whatever. This is something that's clinical grade, doesn't make it medical, just clinical grade. And it has a proper power output. And that's where a lot of people don't understand is power output is how important it is. We're going to dig into what wavelengths do and power and all that here in a second. But the nice thing is with Lightwave, you have that reassurance, that selling point that you're providing something that they should pay for, because you can't get this at home. This is something above and beyond with that. And then the skin prepping, we're going to talk about that more, is huge. Light only penetrates so deep. It has its challenges, its limitations. The better you can prep the skin, the more chance light is going to penetrate. The photon energy is going to be absorbed on the cellular level, and that is huge. Without proper penetration, it just isn't going to hit that deeper levels, and it's not going to have as much of an effect. And that really is why we stand out above and beyond many other devices out there, is because we have so much power and we get better depth of penetration. That in 15 to 20 minutes with our device, you're going to get more than another device may take 30, 40, or even 60 minutes. So just wanted to add that, Ariana. You can.
Yeah, no worries. So understanding the wavelength, just like Mike went over, all of our cells have a unique absorption spectrum, which determines which wavelength, which color of light, of energy will be absorbed, reflected, or passed through. Light must be absorbed by the body to produce the biological response. The term of the wavelength refers from the length of a wave from the start of one wave to the beginning of the next. This distance from one point to the next determines the color of light in a visible light spectrum. The shorter the wavelength is, the less it penetrates and the quicker it's absorbed by the body. So for example, UV, very, very strong when we're outside. It's only hitting the surface of our skin. That's why we have the potential to get sunburned. Blue light follows. It's right underneath UV. We use the 420 wavelength. It's a shorter wavelength, more energy, but there's less penetration. It's only penetrating into the glands of the epidermis. The red wavelength in the visible spectrum, that's a longer wavelength. Less energy is being pushed out, but it does penetrate much deeper. Same with infrared, which is located on the non-visible wavelength spectrum. In infrared, we can't see on your devices. You do have indicator lights. There's one light per board that will light up, and it is how do you explain it, Mike? It's connected to how the infrared turns on. So if that light is not on, that means the infrared lights are not penetrating. Is that correct?
Correct. So on the infrared mode, it's not visible. And this is probably one of the questions we get a lot, like, oh, my infrared is not working. Actually, it is on if there's one red indicator per board. So in the panel, and I have the panel here, you have 6 squares, and we have one diode in each one in one of the corners that turns red. So we did that for 2 reasons. One, so as the technician or the provider that it's actually operating, and 2, it gives a little sense of color to the person being treated, because we've had a lot of people think, oh, it's done. Maybe you've left the treatment room for a few minutes and they take the panel off So you should have 6 red LEDs, one on each board, running during the infrared cycle. Some cameras will detect the infrared, so you can actually use your camera, but generally, if the reds are on, if the little red diodes are indicators are on, you're fine. Everything's running. So yes.
Okay, and going into the depth of penetration. So again, blue light is primarily absorbed in the epidermis, does not penetrate very deep. Red light penetrates human tissue more superficially than infrared light. Approximately 80% of the energy is being absorbed in the first 2 centimeters. Near infrared light penetrates tissue at a greater depth, approximately 50% penetrates to the 8 centimeters. So that's targeting a little bit deeper into the muscles, tendons, bones. Infrared is penetrating into the photoreceptors of our mitochondria, and utilizing both wavelengths in conjunction, it's helping to knock out nitric oxide and push more oxygen and nutrients into our cells.
And that's why you'll see some of our programs utilize a lot more red versus infrared or infrared versus red. So depending on what we're targeting, deeper cells or deeper conditions versus more superficial, you'll notice at the times it's not always the same amount of red light or same amount of infrared light. It actually has different purposes, and we alternate between the two as well. There's some pulsing going on. You won't really see that because it's over 100 hertz and your eyes can't detect that, but pulsing and continuous wave is 2 different things. We're going to have an advanced class where we're going to talk and dig more into the science, what lights and how to control lights to do different things. But just to understand that the protocols are specifically designed to have so much red light and or infrared light for a purpose. So that's part of the protocols that we provide. Go ahead, Arnie.
Okay. So what is light therapy? In summary, the process of exposing the skin to specific wavelengths, colors of light, so the body cells can use the light energy to combat the signs of aging, heal faster and more effectively. The science of skin rejuvenation. Cells contain receptors that absorb photons of light. For example, fibroblasts, mitochondria absorb the light at 630 nanometers, resulting in collagen production. This absorption stimulates a normal cellular function that otherwise occurs naturally within the cell. Light therapy merely accelerates this process, making the cell more efficient and increasing metabolism. Cells become more receptive and responsive to the exogenous factors. Blood flow, the transport mechanism of the body, increases, leading to greater tissue oxygenation, nutritional exchange, and detoxification. Overall, it's helping our cells work more functionally, more optimally, and in return, it's going to repair damaged cells. It's going to, or once the cells become healthy, it's going to increase that cell turnover and duplicate healthy cells at a much more rapid rate than what we would be doing on our own, or what our cells would do on our own.
Right, and to add a little bit more to that, if you want to jump back to that previous slide. So red light is more superficial, and what's really happening is the light, and again, we can go into this extreme depth, but the light is being absorbed on a cellular level and being utilized on different organelles in the cell. Primarily, the red light is going to be functioning or dealing with the mitochondrial activity, which helps produce ATP. So our whole goal with red light therapy is to inundate as many cells as we can as possible. It's a very natural process, and that's a good selling point because a lot of people don't want foreign stuff in their body. We're going to put this red light in there. It's going to stimulate mitochondrial activity. ATP production is going to be increased, adenosine triphosphate. That is going to help the other organelles or subcellular functions improve as well. So it's super important that light wave is not directly making the change. It's triggering a reaction in the human body on a cellular level to make the change. So patients, need to be a little patient when they're doing the treatment, because this is not a filler. This is not something they're going to see a result after just 5 minutes. This is something that they're going to have to do a series of treatments of. Near infrared light also does stimulate some mitochondrial activity, but it helps with cell wall permeability. So part of the challenge with unhealthy cells is they're not able to remove waste and toxins as quick as possible, as well as absorb nutrients and things it needs. So utilizing red light and near infrared light in a combination type treatment is more beneficial because the red light's going to stimulate activity. Near infrared light is going to help stimulate the ability for it to remove waste byproduct and bring in more nutrients. So the two work hand in hand. So just keep that in mind when you're using red light and near infrared light. There is a purpose of using the two, not maybe simultaneously, but an alternating purpose. So just want to talk a little bit about that. A lot of other things are happening. We're oxygenating the skin. Nitric oxide levels are going up. We're helping lymphatic system, especially near infrared light helps lymphatic drainage. So if there's somebody's very toxified, they're a drinker, smoker, just not taking care of themselves, infrared will help as well as red light, will help flush a lot of that out of the system. They may even notice that they feel a little off when after the first couple of treatments, just because the body is now purging out all these bad things. And a dehydration is another factor as well, because on the cellular level, they're like little marathon runners or little athletes. We're now increasing their activity, and the demand is going to be more nutrients, more hydration and such like that. So they're going to consume. So, I think we talk about this, but increasing water intake after treatment is very important, and just understanding what is going on that level. So go ahead, Arya.
Okay. Then we're going to move into the science of acne clearance. So acne bacteria absorbs blue light at the 420 nanometer light spectrum. The 420 nanometer reacts with the intracellular photosynthesizer coperforlin 3, producing a singlet oxygen. The singlet oxygen destroys the P. acne bacteria. Then we follow the blue light with red light at 630 nanometer to stimulate the anti-inflammatory cellular process, also help to prevent scarring. And the result is going to be a significant reduction in inflammatory lesions and sebum levels. Did you want to add to that, Mike?
Yeah, so the blue light we use is 420 nanometers, and it's not UV. So you'll get that question a lot. Somebody's gonna walk in, a kid, either teenage, 14, 15 years old, they have acne, or they're, adult acne. They're gonna ask you, is this UV light? Because that's very commonly used in the derm world. They do some UV treatments, especially for like eczema and some skin conditions. This is not UV. UV starts at 390 nanometers. We're at 420. 420 has been shown to be the optimal wavelength without going into the UV spectrum. And just like in the summertime, you'll see a lot of your acne patients, their acne seems to be a little bit more manageable or under control because they're getting more of that blue and as well as UV spectrum out there in natural sunlight. So we've taken that slice of that light and we said, well, we like that 420, and the studies have shown that 420 works, and put it into our system at a high power. So this is a very natural process, and we're just kickstarting or accelerating the ability for the body to take that P or that porphyrin, that enzyme, and convert it into a singlet oxygen-free radical and go and kill or eat or consume, I guess, the P. acne bacteria is the best way to put it. So it's an antibacterial effect that's happening when you utilize blue light. But we follow it with red light because we have two sides of acne. We have the infection that's happening inside, and then we have the inflammation that's more visible, and we want to address both sides. If we want to kill the bacteria, and then we want to take care of the redness, irritation, or maybe even some scarring, some brownness as well. You can combine this with peels and some more aggressive steps and procedures, but it's always blue followed by red. So just keep that in mind. Blue kills it, creates that singlet oxygen-free radical. We use red light to help clean up that free radical, as well as start to heal the skin. So that's the simple kind of meat and potatoes of what's going on there.
Okay, and Lightwave can also be paired with laser procedures, filler procedures, surgical procedures. The reason is to help maximize for post or pre-surgical, pre-laser. It's to help maximize cellular ATP stores, minimizes apoptosis of neighboring cells during surgery, minimizes surgical wound inflammation response. Post-surgical, it's going to help re-establish ATP production that's stopped by the inflammation from surgical laser procedures, shortens healing times, relieves inflammation conditions. With laser procedures, it is important to not go under infrared light immediately after for post-procedure. You can do infrared prior, 2 to 3 to 4 times prior, 2 times prior, 1 time prior. Afterwards, for first 7 days, just want to have them go under red light only. And the reason is because we don't want to draw any heat to the tissue, specifically for those skin types that are more inclined to get the hyperpigmentation or the inflamed hyperpigmentation. So red light only 7 days after laser, or post-surgical is a little different. With the post-surgical, you want to wait for the stitches to be removed or dissolved, but they can do the red and infrared light post-surgical. Fillers, infrared while they're numbing. Microneedling, same thing, infrared while they're numbing. Go into your procedure, and then you can do red light after. For fillers, it will help with preventing bruising, also will help jumpstart, or also will help take down the swelling following the procedure. Anything to add to that, Mike? Or
no, you're good. We'll get to that when we get the protocols. I think we have a lot more later on that delves into that.
Okay, placement of panels. You do want to be close. You don't have to be super close to where they are feeling a little uncomfortable or claustrophobic. The design of our device is illuminating the full tissue from forehead to chin, neck, décolleté, but closer will push out more energy, and but again, you don't have to be on top of their nose, but close enough to provide them a good effective treatment. The closer you are to the skin, the higher or the more intense energy. The further away the panel is, the less energy is going to be pushing out.
Right, and I was just gonna have a system here, so I might as well just show a few things. So if you have the React 1200 versus the React Pro, you're gonna have a panel where you don't have an arm or anything on that. So, you know, placement of it is not terribly hard by any means. It's just you have to, you know, understand that you have a few ways of adjusting it. So I'm gonna show you just a couple tips and tricks on that real quick. So on the side of your React 1200 panel, you're going to have these wing adjusters, and there's 3 positions on them, 1, 2, and 3 on both sides. So you can use those to raise and lower it. So if you have somebody who's larger or smaller, whatever the case is, you know, feel free to move those up and down so you can raise and lower the panel, as well as open and close it to get it a little bit closer. You know, the trick when you're doing bodies with this particular unit is, you know, if somebody's really wide or something, you basically got to lay it on them, but you can put towels underneath the sides here. I don't know if you can see that. Put towels in here and help elevate it if you're doing a lot of body work. Generally, if that is something you do a lot of, you know, you'd probably consider, you know, upgrading to the React Pro. But again, utilize those. You know, if the face is, you know, inch or 2 away, so you know, if the nose is, you know, within an inch or 2, that's totally fine. If it happens to touch, it's not the end of the world. It gets warm. By no means should burn them, but some people just don't like things touching their skin. So placement of the panel is super important as far as that goes, especially with the React 1200, just, you know, not having the stand-in arm. So yeah, that's it.
Okay, and then of course, protecting the eyes. The FDA enforces a standard for light sources known as maximum permissible exposure, MPEs. The output of light produced by most LED equipment is greater than the recommended MPEs in the blue, red, and infrared spectrum, even though it's not a visible light. So a minimum blackout goggle should be worn at all times when treating the face and the eye. Why? Because we want to protect the retina. We cannot completely block out red light because it's absorbing into the photoreceptors of our cells. It's a deeper penetration. The brightness cannot be completely blocked out. However, wearing eye protection, we are protecting the retina just to prevent any future damage that could occur. Proper skin prep. Don't want to leave on any reflective ingredients. It's not going to penetrate through a jelly mask. You want to prevent, if you don't have a proper skin prep, or if you don't exfoliate the skin prior, it's going to prevent photo penetration, the absorption of the photon energy. Again, like we went over, no penetration equals no change. We want to focus on removing dead skin cells prior to LED treatment, and you can combine it with chemical peels for enhanced skin rejuvenation. It's going to help combining it with chemical peels, micro peels, a good exfoliant scrub, microderm, dermaplane, anything that's going to help exfoliate the skin prior to LED. It's going to enhance timing and degree of results related to skin tone texture, improves elasticity and firmness, decreases hypersensitivity and tenderness, counterbalances thinning of the tissue, and improves skin density, achieves healthier, plumper skin appearance. So when we're trying to treat the skin with chemical peels or other type of modalities to get rid of pigmentation, for example, smooth out wrinkles, we also want to build up the barrier at the same time, and that's what light therapy is going to help do. Standard protocol, this is just very, very basic. They're just going to be exposed under red and near infrared. We're going to start off with cleansing, properly preparing the skin with the AVI enzyme wash or corrective wash, exfoliate with either a micropeel scrub, enzyme mask, expose the skin to red and near infrared light for a minimum dosage of 14 to 20 minutes, apply the AVI dermaceuticals post-treatment. Recommended treatments, twice a week is pretty reasonable, 4 to 6 weeks. You can start with a treatment of 6 just for them to see some change take place, and then you can always build onto it. Also can combine with topical light infusion, which we'll go into next.
And real quick before you hop in there, so earlier I mentioned you had a book. You should have a book that looks like this, just to say Lightwave Theory Protocols. In here has all the protocols that you need to utilize, and they're all written in very similar instructions. Step 1, prep the skin. Step 2, protect the eyes. Step 3, perform the treatment. Step 4, post-care, and so on and so forth. So for each program you see it on the main unit, as you scroll through, there's a page in here that describes a standard boilerplate, how to use it, very straightforward, and you can take it from there. We're just trying to give you something to start with, so you know exactly at a minimum what you should be doing, and you can build up from there. So those are all included. We also have videos on our YouTube channel, and hopefully you guys have been up there. If not, let us know. We'll send links out. So our YouTube channel has videos on how to do all the lightwave treatments, as well as the topical light infusion treatments we're going to talk about, as well as combinations, lightwave topical infusion, and then microneedling, and a few others are up there. So you have really good videos that have been cut down. Instead of being a 30-minute treatment, it's like a 3 or 4 minute video. You can see step 1, prep, protect, infuse, light, whatever it is. That's all up there for you as well. So the resources on protocols are good on there, and we'll make sure we get that link to you guys.
Okay, and then moving on to acne protocol, very similar process steps. You want to cleanse the skin, exfoliate the skin, expose to blue, followed by red light for about 20 to 30 minute session, just depending on the device that you have. Apply AVI dermaceuticals post-treatment. They can come in twice a week. They can come in a little more often if possible. The main reason is because the blue light will purge a lot of congestion. So it may take some time depending on the severity of the acne. So they can come in 3 times a week, 2 times a week, spaced out at least 48 hours apart. General amount of treatments, again, depending on the severity, start with 6 to 8, and then you can always build on top of that. Average improvement is from 60 to 80% reduction in acne lesions, and can last for 4 to 6 months with a good maintenance plan. Immediate effects of LED, we went over the science of it. Mitochondria in the cells absorb photon energy to convert it into biochemical energy known as adenosine triphosphate, ATP, resulting in increased cellular activity and mitosis. Also releasing endorphins. Your clients will have that nice relaxation, less stress feeling after a treatment. Increases blood circulation and oxygenation, reduces inflammation, begins to restore normal cellular function, and both visible and red, near infrared light have been shown to promote at least 24 different possible changes at a cellular level. Long-term effects, it's focusing to repair damaged tissue within. For example, customers with deeper penetration issues, or I'm sorry, deeper pigmentation issues. It's going to help optimize all the damaged cells to help inhibit future pigmentation from surfacing. Increases lymphatic system drainage to detoxify the skin tissue, reduces pain, increases moisture retention, thickens and firms the skin, smooths out uneven pigmentation for more consistent coloration, increases production of collagen and elastin, reducing plasticity and the appearance of fine lines and wrinkles. Do you want to add to that, Mike, or keep going?
No, keep going. That's good.
Okay, after a lightweight treatment, removing the goggles, applying some post-treatment serums. We highly recommend the Hydrating Recovery Gel, as it includes green tea, very potent antioxidant that's going to help eliminate elevated ROS, which usually occurs when you're first going into the light. When your clients are going under light treatment, mainly because of what Mike was talking about, a lot of toxins is in our body. So this light energy is a little bit foreign to our cells, and our ROS usually increases. So if we can utilize a treatment, either post-treatment or have them use at home, that's going to help eliminate all that oxidative stress. So then the light therapy can work more effectively on our cells, and they're going to see visible results a lot sooner. Another good antioxidant to recommend is the Intense antioxidant, as it has astaxanthin in it. That's going to protect their skin from being outside in the environment for us, even inside the fluorescent lights that are not very good for us, things that we eat, the sun, UVA, UVB, just all the factors that causes oxidative stress. It's so important for them to go out and protect their skin, specifically while they're getting treatments done, because the overall goal is for them to see change. And there's a lot of amazing ingredients that are going to help in conjunction to that. And we'll get into, and topical light infusion will also help with that. And then, of course, sunscreen. And then before your clients leave, you want to make sure they're increasing their water intake, because they don't want to have that, they don't want to have the opposite effects. And one of the other reasons Mike mentioned, the infrared light is helping to get rid of the waste byproducts, detoxifies the tissue. So drinking more water, just like if they were leaving a massage, is ideal. Suggest appropriate retail products to help speed the results, continue the treatment at home, set up next appointment, tailor expectation, and document the progress, because it's a very slight change. By documenting it before and afters, or so then for your clients to see the change, because it's very gradual. Following setting expectations, it's a proven clinical science that's the goal is for healthier skin. Results are not instant. It takes body for the time to repair itself and for the new healthy skin cells to surface. Series of 6 to 12 treatments are recommended to be performed in the first 3 to 5 weeks, 2 to 3 times per week. Maintenance is recommended every 4 to 6 weeks. Results will peak 4 to 6 months following the treatment completion. For enhanced results, always use topical light infusion products and AVI. And then
one thing on that too, as far as setting expectations, a lot of people have unrealistic expectations. It's, they spent the last 10 years destroying their skin, and they want to come in the next 10 minutes, you reverse all that. I mean, we have to be realistic about it. It's a process, and explaining the light and what the value is, and then the process and we'll go through protocols and treatment programs that we're going to go over here in a minute. Explaining to them that this is going to take time, that they need to make that commitment. Just like if you want to lose weight, you diet and exercise, you go to the gym, you work out, you eat better food, and there's results. It doesn't happen in one day. It's not like they can go in the gym and all of a sudden you drop 10 pounds. So same thing with skin fitness. This is a lifestyle. They need to make that commitment. They need to come into you, allow you to do these treatments, a series of them over time, as well as at home. follow up, and you as the professional are going to, prescribe in a way, products for them to use, a cleansing regimen and a moisturizer, antioxidant, lighteners, or whatever the case may be. So, you being the professional, you have to tell them exactly what they need to do, but set those expectations in a way, because the best thing you can do is under promise and over deliver. Hey, it's going to take me 4 to 6 weeks and we're going to see this change, that change, pigmentation is going to fade, the fine lines are going to start to smooth out. If that happens in 3 to 4 weeks, I don't think anybody's going to be upset about that. So we've had a few providers, oh yeah, come in 10 minutes and look 10 years younger. And unfortunately, that's not really a true expectation. And then disappointment probably is going to exist because of that. So just, I'm sure you've been doing this long enough, you know how to do that, but we just want to make sure you understand that, we're here to help long-term. This is not a filler or a mask. We're not fixing, we're fixing the root issue. We're not just putting something over to hide it. So.
Okay. Current health conditions, skin conditions also can affect patient results, such as excessive drinking, smoking, age, the amount of skin damage, consistent tanning, skincare routine, skin type, and then overall health of the individual. So not that they can't get to that goal, but if they're committed, if they want to commit, it's just providing them the right protocol to use at home with the products and the amount of treatments that would be needed for them to get their skin healthy. So let's go over a few result pictures. This was taken after 8 Lightwave sessions over 4 weeks. It was also taken a few months following the treatment plan to show improvement in the collagen and elastin.
And these were standard kind of lightweight treatments with no topical infusion. This is basic cleansing, some at-home care, red infrared light, a series of 8 treatments, or like basically twice a week on this particular ones. And, so that's, at a very minimum, that's the basic kind of treatment and kind of results we would hope to see over a period of time.
This next image is great because it's after picture taken immediately after her 4 treatments. And the reason why I wanted to post this, because you can already see change happening just after 4 treatments. And this is maybe right when her cell turnover just occurred, but you can see there's already a lot of change taking place, and she had quite a bit of damage prior. So with more treatments, more change is going to occur. This one is a 18-month-old tummy tuck scar, and what a difference just after 3 treatments, 3 lightweight treatments. It's what helped fade off the scar, and it's an older scar. It's going to determine on the type of scar, how old it is. It's not going to do miracles, but the whole point of it is to get the skin, get the tissue healthy, and the healthier the tissue, the less visible the scar will probably be. And then severe acne. This was 12 treatments, blue followed by red. She was also on the ABI home care kit, all corrective products she was using at home. Following after getting her skin under control with the acne, she also did 12 treatments of the red and near infrared, a couple chemical peels, salicylic peel to work on the scars. Did you want to add to this one, Mike? Because I know
no, I think you're good. I think that's pretty self-explanatory. It's, yep.
Okay. Average lightweight pricing, series of 3, $299 plus, series of 6, $499 plus, series of 8, $599 plus, 20-minute session, about $45 to $75 plus. Upselling with another service, you can add an additional $25 to $50. Pad sets, an additional $25 to $35 per hour. Maintenance, $75 to $100. Obviously, that's going to be determined on what protocol you decide to do when they come back for maintenance. If you're including topical light infusion with your LED, it's going to be $155 or higher. And then, of course, combining with other applications, that's going to be determined on how you want to package that. You can upsell them on the light therapy once they understand the benefits of it. Biggest thing when you're pricing light therapy is just having them understand what they're getting, because I always think on this note, it's like, why would you not want healthier skin? Why would you not want to build or to enhance the service that they're coming in for already? I mean, it just makes sense. It's like it's gonna optimize, the outcome's gonna be so much better by combining light therapy with all your other services. You can start there because they'll start seeing a change, especially that they can compare against having the service without light therapy. And then once you add light therapy in, probably more inclined to come in and do more treatments, multiple treatments, because again, the overall goal is to get that skin as healthy as possible. Would you want to add to that, Mike?
No, yeah, I think we're good.
Okay. And then benefits for your practice, you're targeting all age groups, attracts new patients, maximizes return on investment because Lightwave offers treatments for many conditions, offers new, safe, effective treatments with no patient client downtime, provides excellent revenue opportunities. If you price it right, package it right, treat year-round, all skin types, easily incorporates into existing practice, augments existing therapies such as injectables, IPLs, microdermabrasion, chemical peels, and delivers simple treatment protocols. Should we start with questions right here or just go right into
Not
TLI?
questions yet. So I haven't seen anything typed in. So
Okay.
if there's any questions, I'm sure they would type them up. But no, we're good. So, and there's to kind of recap the Lightwave side, it's all about healthy skin. If somebody's coming in, we're working on how can we get you healthy skin, repair the damaged tissue. So it's a very easy method to offer a high quality treatment that's safe on all skin types, can be used year round and help repair damage, unhealthy tissue. So that's really the nuts and bolts of it. So now we're going to jump into some topical light infusion, kind of discuss that, and then we'll go into packages and pricing and all that good stuff as well. A lot of what you'll see, we do a lot of combinations between topical light infusion and Lightwave as well. So that's kind of where we're going to dig in. But I'll let you kind of jump into it, Ariana.
Okay. Well, topical light infusion brings the power of LED light therapy and functional topical formulations into one powerful treatment program. The acronym of topical light infusion, TLI, can significantly increase the effectiveness of topically applied functional skincare without pain or downtime. The TLI formulation saturates the deeper layers of the skin to pure topical ingredients that will effectively enhance what light therapy is achieving on a cellular level to increase noticeable change much sooner. So the difference between Lightwave and topical light infusion, with Lightwave, no topical is used. We don't want anything to prevent the photon exposure. We want those photon energy to go into the tissue. Light is exposed to clean, exfoliated skin. Light is absorbed and interacts with the cells. We're using the light energy to stimulate the cells to enhance the ATP. Topical light infusion, topical is being applied to the skin, depending on the formulation, whether it's a serum, a gel, a cream, or gel mask. Light is placed over the topical. The topical is absorbed and interacts with the cells, uses topical ingredients to interact with the cells.
Right. And on top of that, before we hop into a little bit more topical light infusion, so LED therapy, like Ariana was just mentioning, it's all about the light interacting with the cells, and that's on a deeper level. So that light penetrates through the top layers of skin and gets down to the dermal layers, and we're stimulating young infant cells, endothelia, epithelial cells, helping build collagen and elastin. Where topical light infusion, we put this layer on top of the skin, and we're using light to help infuse that, and that's going to help address the top layers, more superficial side, into some degree. So there's two different layers, and we're kind of sandwiching the skin with LED therapy and topical infusion and trying to address more cells by utilizing the two platforms, together to get a better result. So, people ask, well, why do I want to do topical infusion versus LED therapy? Well, you don't really want to do one versus the other. You really want to do both. And if it only adds 10 or 12 minutes to the treatment by utilizing two together, it makes a lot of sense. Topical infusion, as we'll kind of talk more about what it's doing, and LED therapy, what it's doing, they really work hand in hand. So there's a huge complement between LED therapy and topical light infusion.
Okay. So all skincare ingredients, compounds have a molecular, what's called a molecular weight. And that can be expressed in Daltons, which is the sum of all the atom weights in the molecule. As our human skin is an excellent barrier, it's going to determine what's able to penetrate past the stratum corneum and then what's going to be left out or just surfaced. And in ingredients that are measured 500 Daltons or lower, they have a better chance to get past that stratum corneum. But ingredients over 500 Daltons, there's going to be a limitation. And with topical light infusion, the goal of topical light infusion is to overcome the barrier and push those larger molecules to the lower layers of the tissue. And how it's, and for example, these are molecular weighted ingredients that are known in the skincare industry, such as peptides, epidermal growth factor, hyaluronic, collagen, and it's going and it shows the structure weight, the Dalton, the molecular weight of these ingredients. So what's the goal is to drive, the larger molecules past the barrier and into the lower layers of the skin. We also combine with smaller molecules because of course those have amazing benefits too. So those are going to penetrate on their own, but we want to use topical light infusion to get the larger molecules past the barrier. And how it works is the light, we're utilizing specific wavelengths and very specific pulses of light. And the step is applying the topical to the skin surface and exposing it to a specific wavelength and also a specific pulse of time. And how it's working is as the light pulses on and off, when a light pulses, it's pushing out an intense amount of energy at one time, and then it's dissipating. And then it's going to pulse again and push out another intense amount of energy. So every time that intense amount of energy is targeting those molecules to go into an excitement stage, which changes the shape. So it basically bends it and then goes back to the resting state. So every pulse, every push, it's going to bend it and go back to the resting state, which we call an on-off cycle. And the kinetic motion, so the repeated on and off stimulation of the molecules causes them to bend and flex, move into and through. And the selected pulsed LED light causes the molecules to bend and flex. The molecules absorb the light and changes shape during the on cycle, so that's when it's bending. Then during the off cycle, the molecule dissipates the light and returns to the resting state. So that kinetic motion, it's almost like a vibration motion, is what's pushing it further and further and further into the tissue. Did you want to add to that, Mike, or just keep going?
Yeah, I kind of just a recap, like she said. So topical light infusion, we have this layer of topical. So we have 14 different specific specialized formulations of skincare. We have different settings of light that correspond directly with those. So when the light is broadcast on this topical, what's on top of the skin, as she said, the light is going to stimulate on molecular level. The skin is a barrier; it doesn't want to let things through. 500 Daltons, it's doing its job. That's great, but we want to manipulate and beat that. And there's obviously you can do microneedling and other technologies to help product penetration. We found with light that is if we stimulate particular molecules on a molecular level, they actually bend and fold and hinge upon themselves and become more conal. So that's what she's talking about, that on-off cycle. You won't see this because it's happening so many times per second. Human eye can't actually see it. Plus, it's on a molecular level. We just can't see that either. But what happens is it opens and closes, or it hinges and folds on itself. And we're doing this hundreds, if not thousands of times per second to help manipulate that and allow these different molecules, hyaluronic acid, vitamin C, different peptides to help get more of those in. It's very safe on the skin, and it's very safe on the compound or the topical as well. So in a nutshell, it's just the light on and off is creating this stimulation. It's creating this molecular movement and vibration and helping get more saturation and depth of penetration. So the whole goal with topical light infusion is not just to get a little bit more in, but get it more in deeper. That way we know that these skincare formulations that are really beneficial can do their job and become more effective. But yeah, good.
Yeah. Because they're able to target the fat fibroblast cells and melanocyte cells, which is deeper into the lower layers. This is a 40x magnification of the epidermis and dermis prior or passage protein delivery, which wasn't using topical light infusion, and then the topical light infusion protein delivery. And this was after 60 minutes following the treatment. It does take a little time for the ingredients to interact and for that full saturation to occur. So they will see some change immediately after the treatment, but more change will take place 24 hours later. And then we're going to go into the categories of topical light infusion treatments versus boosters. So
Ariana,
the treatment, sure.
I just want to show a quick map of all the treatment protocols available. I'm going to take control for a second and I'll throw it back at you. So let me grab control real quick here, reclaim host. So here is a listing. Let me share my screen. Sorry. Share screen. Yes. Yes. Share. Of all the different topical light infusion treatment protocols that are available. And this chart's available online. If you need it, we can email it to you as well. This gives you basically a listing of all the 14 different options available. It also gives you the treatment times. And if you're combining Lightwave and topical infusion, which goes first, we do Lightwave, then infusion. There's 2 steps to the topical formulation. Try to get rid of all that extra stuff on here. How long it is if you add the LED. So this is a nice little cheat sheet for you to have in your facility. As you can see, there's quite a few different treatment options here. We generally recommend focusing on 1 or 2 or 3 when you initially get going, just to kind of get familiar with it. But your starter pack that came with your system should have at least one of all these that are listed on here. So there's a box look kind of like this that came with it. It has 14 different applications in here. Some are gels, some are masks, some are creams, some are more serum based. There'll be a different formulation. So when you start utilizing it, if you just got your system here recently or you had it for a little while and you haven't touched this, what I would recommend doing is grabbing that box, opening it up, getting all the formulations out of there, kind of lining it out and looking at the programs on your system or even the sheet right here and kind of mapping out. Because, for example, and this is one thing that kind of confuses maybe a new owner, is the wrinkle repair has a step 1 and a step 2. So you can see this dark blue and light blue. These 2 work together. And when we say step doesn't really mean, A then B. It actually means layer 1, layer 2. So we're going to put layer 1 on, and then we're going to top it with layer 2 and then do that wrinkle repair treatment. So that's just something that, for you to know that there's different times where you're going to have a single application or a single layer, where you're going to have 2 layers, and some might be a little vial and a gel mask, like a little pouch. I didn't have one here. But our protocols outline all that. You can see that as we kind of go through that in our videos too. We show that as well. But just keep that in mind. That's one of the kind of the new things you may see or may cause a little confusion at first, but just kind of line it out and take a look at it. And that should kind of help you with that. Let me throw it back to you, Ariana.
Okay.
Let me control 1 second. Where are we at? Where'd it go? Participants. Let's throw it back to make host. There you go. You are host again.
Okay.
Bring up that PowerPoint. You may have to reshare it.
Oh, got it.
Yeah, just reshare it. Yeah, just say share screen.
Hold on 1 second. I have to go into
Sorry, I should
Right.
have done that.
Are we good?
Yep.
Okay. I just I need to figure out what happened to my hold on.
Oh, it was up.
Okay, give me one moment. I'm sorry. I'm just not seeing here. Nope. Oh, goodness. Why am I not? I think what my issue is to move it back and forth. I'm not seeing that screen anymore where it shows me. Does that make sense?
Yeah, let me take a look.
I don't know how to go back to that to control it. Oh, it's okay.
Click over here.
Okay.
And then,
Oh,
there it is. There you go.
okay, sorry,
Go
everyone.
backwards. Sorry.
Sorry, everyone. Okay, let's go back to this slide right here. So the treatment formulations, you'll see under in this box right here, it's the wrinkle repair, brightening, post-recovery, anti-blemish, body firming, revitalizing retinol. These type of formulations are meant to be performed in a treatment series, as the ingredients included are going to work over time. We suggest to at least start with 6, and then you can always suggest more. There's also situations where you can combine it with boosters. Now, what boosters are, they're a little more instant change, but it's also a little temporary. So it's going to dissipate all that saturation is probably going to dissipate after about 48 hours or so. So a couple different ways to market these. You can create a full package that may include just the treatment series, whether it's wrinkle repair, brightening, post-recovery, anti-blemish, or you can combine a package with treatments and boosters, and that can be done weekly. So just depending on how soon they want to see results, it may make sense to do treatments in combination with boosters. You can also do boosters as a series treatment plan. So there's a lot of different ways to market it. But if they are performed weekly, whether it's a treatment in combination with booster, the ingredients are targeting all the cells from the upper layers of the tissue all the way down to the lower layers of the tissue to effectively transform the skin much quicker. So it's a great opportunity to start with a smaller package if they don't want to come in frequently for the Lightwave treatments. You can combine the Lightwave with TLI. You can sell 3 infusions for $300, 4 infusions for $400, just to get them in and to see some change take place. It will it's just building on to healthier and healthier skin over time. You can also add to your existing modalities. So one way to package it is to have a basic pricing for if it's just a basic protocol like a micropeel, Lightwave, infusion, post-care, that can be priced at $140. If you're going to combine it with dermaplane, which you already have priced at $50 to $75 just for that dermaplane treatment, then you're adding that $50 to $75 to your $140. So that's how to price your Lightwave infusions and your other modalities that you're using with it. But for basic weekly treatments, you can charge $140 or higher. The boosters are the collagen renewal, Peptide Pro, hydrofortifying ceramide, hyaluronic peptide, the plumping, hydration, EGF firming complex, Pro Power C, resveratrol illuminating. I always suggest to look in your topical light infusion booklet that Mike was showing you at the beginning of the training. That's going to be your ingredient Bible. So past the protocols, you will have protocols step by step, very basic. Past the protocols are, you're going to find the data sheets. The data sheets are there's going to be one data sheet per product. So for example, the wrinkle repair has the 2 steps. Step 1 has all the serum, that step 2 has 8 different peptides in there. That's going to be your Bible of knowing what treatment is going to benefit your clientele. There's a lot of boosters that's probably going to be overall for many of your customers. So it's going to target a lot of different concerns. And then there's ones that's going to be a little more specific. So definitely look at that, at the data sheets and study on those ingredients, because we provide a lot of good information. Every single ingredient has a description in there how it's benefiting the skin. We use very high percentage, very high percentage active ingredients. We also include antioxidants. I always tell my med spas, you can I'm sorry, my lost for words here. You can market these treatments prior to the weekend, because they're going to have a nice instant glow, a nice instant change, a nice instant boosted product. But there's also a lot of ingredients, a lot of antioxidants that's going to protect their skin from the fun that they're having over the weekend, whether they go out drinking or out in the sun. So it's an extra way to protect their skin. And add on to trying to treat it to get the skin healthy. Did you want to add on to that, Mike?
Yeah, I'm just going to mention that. So again, we provided the book for the topical light infusion protocols. So you should have a manual. It looks like this, has a box of the TLI, says topical light infusion protocols. And there's all the physical protocols that we're going to go over a few of these here in just a sec. But on the back part of that is the ingredient deck. So if you're an ingredient junkie and you want to know everything that's in these, you just got to flip to the page, match the corresponding name with the actual product you're using, and it'll have everything in there. So make sure, if you don't have this, email us. We can send you over a link to it. You can download it, read it online. And there's also videos, again, like I mentioned, that are specific about the actual treatments. So yeah, I just wanted to make sure they know they have this as a resource.
Yeah. So I put up a couple different examples of treatment packages. One example would be utilizing or having them come in for anti-aging wrinkle repair treatment with just the wrinkle repair step 1, step 2 every time they come in. And that would be suggested 8 to 12 treatments, depending on the severity. Or you can combine your treatments with boosters, and we have multi-packs. So we have for example, an anti-aging multi-pack. It includes the 8 treatments that you're going to perform on your one client weekly. And it also comes with a full protocol, so you know which TLI treatment you're going to do for that week. And then you can, depending on what you decide to do for skin prep, our polishing pumpkin micro peel, it's not as intense as a regular peel. It's actually best to do it more often. So that's a good product to use for prepping the skin weekly, as it's not going to overcompromise their skin, but it's just going to add to the cell turnover. It's good, softening the skin. It gives a little bit of brightness.
Ariana, can you switch your slide to that slide? I think if you go to the next one, can you go forward one?
This one right here?
I'm not seeing, I'm still seeing the treatment overview and boosters. I'm not seeing.
Oh, interesting.
I'm not seeing.
You're not seeing anything?
Well, I see the previous slide. Should be the next one. It should have the lightweight topical wrinkle repair treatment.
This one you're not seeing, correct?
No.
That's odd. Okay.
Yeah, at least not for me.
Let me escape, and then what about right now? Do you see it in the PowerPoint?
No, I do not.
Okay.
It's interesting.
Let me go back to share.
Yeah, share. Give it a. For some reason, didn't update.
It did not update.
Oh, I'm not seeing it. Yeah, they said they say they see a black screen. They thought it was me. So let me.
Anything coming up now? So this one you're not.
No, I wasn't seeing. So resume share that plus. I think that's it. You had it on pause. Sorry.
Sorry, everyone. Now can you see my screen? Okay, going back to what I was talking about before. I know we're running long on time here, but this gives you a nice overview of how you can package treatments, whether you want to do a series of 8 and include the boosters, or if you just want to do the wrinkle repair step 1, step 2 for the full 10 treatment that comes in your box, or 8 treatments. It just depends on how you want to package that. Then we have facial protocol examples as well. So for example, I added, or I put up here the Be Bright peptide boosting facial. This gives you the step 1, what to use for the cleanser. You're going to start off with a corrective wash. The peptide facial, it's helping with Dolce detox, or helping to detox the skin, photo damaged skin, sensitive skin, rosacea skin types. It's adding a lot of nutrients, peptides, and antioxidants into the infusion, but also firming the skin. So this basic protocol is starting off with cleansing with a corrective wash. Step 2 is exfoliating, applying the cranberry scrub to exfoliate the skin. Then we're going to go into a treatment mask, applying the honeysuckle hydrating mask. And then the next step will be infusing the peptide pro booster. This particular booster treatment does come before it is operated before the red light on your machine. You'll notice the infusion comes first. Pause time is just to take off using a warm wet towel to remove the tacky layer that's left over on the skin after the infusion process. And then the red light, the reason why we're using red light afterwards is to help reduce inflamed skin, just in case they have some inflammation, but also help to penetrate the nutrients into the cells. Following an infusion protocol, they don't need much post-care. I would still add some antioxidants and some sunscreen. It's a treatment you can, again, charge for $155 or higher. The corresponding product that would work really well with this treatment for ABI would be the moisturizing antioxidant. So that just gives you an example of a facial. I also added the Pro Power C boosting facial. This one is starting off with the corrective wash, then we're following it with the exfoliation process using the polishing pumpkin micro peel that you can use steam with as option. We're applying the Triple C purifying mask, leaving that on for 7 to 10 minutes, removing it with warm water. The Lightwave preset is going to be infrared for the specific infusion, because we want to reduce redness, detoxify the tissue. But infrared, also just a quick note, it does therapeutically heat the tissue, which helps open up the pores. So another reason why it's a great option to do for the, or option to utilize before the Pro Power C specifically, just to get that deeper penetration. The Pro Power C has a few steps, which you'll read in your protocol book. And then after the treatment, again, applying some basic post-care, and then they're on their way. So these treatments can run 30 minutes. This one's actually pretty quick. This one's probably the fastest treatment. So this whole entire facial can most likely get done in less than 45 minutes. So that your customers can come in on their lunchtime, before work, after work. It's a quick treatment, less labor for you. The only labor you're doing is cleansing, exfoliating, and applying the products. That's it. The machine is doing its job. The Lightwave, it's doing its work with the photon energy, and then the infusion is pushing those ingredients further without having to hold prongs or, you know, I mean, and then you have your Lightwave treatments to help with your hands cramping up that you can use after your clients come in. So a lot of uses for topical light infusion and Lightwave. It's to keep the protocol simple. It's to provide effective results. It's to infuse ingredients that you see all over the internet, you know, ingredients that are very popular, that are beneficial. It's clean. There's no unwanted ingredients in there that's going to cause irritation. Our vitamin C specifically, it's a dry freeze, 80% ascorbic acid. There's no irritation because it's not activated until the time of the treatment, and it's activated with other amazing ingredients, not just hyaluronic, but you'll see a lot of other dry freeze products out there. The activation serum's very basic. We included a lot more in there because, as you know, vitamin C works well with other ingredients to be more effective. And when you're looking at our formulations, there's a nice balance of what's going to treat the skin, what's going to protect the skin, what's going to build up the barrier, and then add to that moisture retention. So that's what TLI is, the concept of it. And a couple result pictures. Here's a 8-treatment wrinkle repair treatment plan that one of our providers actually gave us this result picture. So it was just wrinkle repair on its own. She did 8 treatments, and this picture was actually taken immediately after her treatment plan. One of the most noticeable things that your clients will see, the change that they will see, is the softening of the tissue, and Lightwave can do this on its own as well, but adding the infusion products will get there a bit quicker. So that's a huge change. And then over time, there's going to be more decrease of wrinkle depth. Same with pigmentation, which is the next one. This is in combination with the Lightwave and the brightening series. I believe this was 8 to 12 treatments. I'm not entirely sure the amount, but what we're focusing on with the infusion is not only is the infusion going to help break apart the pigmentation that's surfaced, but the light therapy in combination with ingredients in the brightening repair is going to repair all the damage on the deeper level. So then that way it helps inhibit future damage from surfacing. So you can tackle pigmentation. It's just a process, and with the right ingredients and consistency of the light therapy, we have seen some remarkable results, including melasma. And this one's a booster treatment, so it gives you a little idea, an idea of how the booster works, because it is a little more instant. For example, we use the EGF firming complex. This was prior doing the treatment. I think I added I believe I did the oxygen mask. I did a scrub in the oxygen mask prior to doing the EGF firming complex. This was taken immediately after, and then this was taken 3 days after. So they do get a nice instant change. It's great to do before events, if there are bridesmaids, before bachelorette parties, again, before the weekend, because you're going to help protect their skin. A lot of different ways to market these, and they'll love it. It's a relaxing treatment for them. They see a nice instant change, and then you can build onto it, because the more they get done, the healthier and healthier and healthier their skin will be. Following this, it just gives you a little information of our enzyme mask, our prepping mask, our treatment mask that can be included in your protocols, in your topical light infusion protocols, your lightweight protocols. These masks have a lot of really, really good ingredients in it. Our ingredients, we're focusing again on treating the skin, but also protecting the skin, nourishing the skin, and increasing water retention. These particular back bar masks, they come in 8 ounces. If you factor that out per treatment, you get at least 27 and 30 treatments out of that. It's about $1, maybe $2 per treatment, cost per treatment. Then we have our full ABI retail line that is helping to support, enhance, and protect the longevity of your Lightwave TLI results. Powerful, chirally correct ingredients, peptides, antioxidants, exfoliants, ceramides, nutrients, highest recommended percentage, purest form, no unwanted extras, maintain skin structure and barrier function, reduces free radical damage, environmental assault, helps cells function properly. This is just a basic skincare regimen for them to use at home, but just what sets us apart is this whole process. It's a system, and all of our research is based off of clinical research, whether it's ingredients, what ingredients works well with light therapy, the type of treatments, the settings on your Lightwave therapy devices, very, very advanced settings that our engineering department did a lot of research on, and everything's built in for you. If you follow the system, your clients are going to have amazing results at the end. Mike?
Yeah, I just wanted to recap. I sent a link to the ABI skincare site. So ABI skincare is our skincare line. I know many of you have your skincare lines, and that's fine. We have some really good products. We'd love for you to take a look at it. But the topical light infusion information and pricing and all that is available on there as well. So if you have not created an ABI skincare professional account, please do so. We'll approve it. That gets you wholesale pricing, professional access. You'll see protocols, ingredient decks, all that information up there as well. Topical light infusion is different from ABI. It's specifically designed to be used with topical light infusion with the light, where ABI, we have our retail products, you know, like washes and moisturizers, antioxidants and such like that, as well as your professional products. One thing about the ABI site or product line is nice to know is that it is no opening order minimum, no per order or anything like that. So if you just like our professional products, that's great. Buy those, put them in the office. Back bar products, you know, if you like our retail products, you can buy just those. But we've designed this, initially it was designed to work in conjunction with the LED therapy, help prepping pre and post treatment. Now it's a full standalone line with products that are specifically designed to incorporate with our protocols to make it more comprehensive. So between Lightwave, topical light infusion, and ABI, you have everything you need to perform treatments and open up a full skincare center and address a variety of skin types and conditions. So I sent a link in there. Like I said, take a look at it. I just want to make sure everybody understood that. And there should have been some information included as well on that. Anything else, Ariana? What do you got?
I think that's it.
Okay.
I'm sure I'm missing things, but I guess we'll cover those in future sessions.
Yeah, so I didn't see any more questions. So if you have any questions, feel free to email us. info@lightwavetherapy.com is one of the best email addresses, or us directly if you have my email or Ariana's or others. You know, send us an email or pick up the phone, give us a call. We do appreciate you being here today. We are going to have other training sessions going on. We're going to dig more into protocols and pricing and get a little bit more in depth. We just at least want to get this out there, get the ball rolling, get you a few good programs and protocols so you can perform those, understand a few of the aspects. We're also going to be starting our in-person 2-day certified advanced training here in Phoenix, Arizona. We'll have a schedule out hopefully the next week or so. And then we're going to try to be more consistent on like Mondays, doing trainings like this, where we'll talk more product specific or protocol specific, and keep those kind of short, maybe a half hour-ish, 45 minutes. So you guys can pop in, learn something every week or every other week, depending on what the schedule looks like. So, if you need anything, please feel free to reach out to us. Let us know. So I appreciate everybody being here. Ariana?
Bye. Thank you everyone for listening.
And we will post
For
this
our first
online. I'll
time.
get a link out. We'll clean up the video. We'll get this posted online, and you guys will be able to review this or look at it again if you missed anything. Thank you.
Thanks. Bye, guys.
Bye.